10 signs and symptoms of brain tumor. A brain tumor may sound like a scary, even devastating possibility. Basically, a growth of abnormal cells in your brain. A brain tumor can be benign, that is, without cancer cells, or malignant with cancer cells. Understanding brain tumor symptoms early can mean a better shot at a positive outcome. Brain tumor symptoms are caused by their location or the pressure they put on the brain, which is why symptoms vary from one patient to another. If you have multiple signs and symptoms of this problem, ask your doctor to check your health levels. Here are 10 common signs of brain tumor that you should know. 1. Seizures, mostly partial. Believe it or not, seizures are the commonest symptom of brain tumor, with about 60% patients experiencing them. They occur mostly when the tumors are located in the central part of the brain and have a slow growth rate and many lesions. They are also common in cases of slowly growing gliomas, tumors in the glial cells, convexity meningiomas, tumors on the meninges, brainstem tumors, and when the tumor has started metastasizing or spreading to nearby cells. Seizures occur when the tumors interfere with the electric signals between nerve cells, either disrupting or intensifying them. Depending on the location of the tumor, the seizure can be generalized, affecting the entire body, or partial, resulting in spasms in a specific group of muscles or affecting specific nerves. Sometimes, a seizure can make you feel strange in a way that you won't be able to describe afterward. Sometimes, you won't even be able to recall this phase later. These are focal seizures. Partial seizures are probably more common in the initial stages. Some people may notice a warning signal before the seizure occurs, like a headache, nausea, or dizziness. If you have no history of seizures, you must get it checked by a doctor to rule out the possibility of a brain tumor. About 60% brain tumor patients experience seizure. 2. Headaches, inexplicable and resistant to medicines. A new persistent headache is a common sign of brain tumor, though not the first sign. About 50% of all brain tumor patients complain of headaches, but not usually at tumor onset. Either the tumor puts pressure on the brain or blocks the drainage of the cerebrospinal fluid and raises the ICP, which results in headaches. It's difficult to differentiate between a tumor-related headache and a normal one you might get because of sinus, flu, or migraine. The pain may be throbbing and resemble a migraine, or may even be like a tension headache. It was believed that a tumor headache is worst in the morning and gets better within a few hours, but this may not always be the case. The pain also shoots up when you do something that increases the pressure in your head, say coughing, sneezing, or bending. Over-the-counter medicines, rest, or sleep do not help. It might also be accompanied by nausea and vomiting. Watch out for a new, persistent headache that is worse when you cough, bend, or sneeze and doesn't improve with your regular headache medicines. 3. Speech and hearing, difficulty speaking meaningfully. A sudden loss of communication skills can indicate a brain tumor. You may slur, stutter, speak haltingly, grope for appropriate words, muddle words, forget names of common objects, and be unable to string a meaningful sentence together. Sometimes, you may speak fluently, but your speech may be filled with non-words. You may be able to write but not read out what you've written. These symptoms can also indicate a stroke or a migraine attack. All three are serious medical conditions and need attention. How does a tumor affect your language? Your brain has two main speech centers, and a tumor in any of these lobes can make conversations difficult. Wernicke's area near the temporal lobe that helps you understand language and decipher others' speech. Broca's area near the frontal lobe that helps in speech production so that you speak meaningfully and fluently. This difficulty in using and understanding language is known as dysphagia or aphasia. You may also have difficulty repeating after others if the tumor is in your parietal lobe and is affecting the inferior parietal lobule, another area associated in speech production and speech repetition. However, if you cannot understand someone else's words, and it may also have to do with hearing loss associated with brainstem tumors. 4. Vision problems, loss of vision or double vision. Blurred sight, vision loss that comes and goes, or seeing floating shapes like small dots or thin strands in front of your eyes can all indicate a tumor. A tumor in the occipital lobe may mean loss of vision in one eye or sometimes both eyes. A tumor in the brainstem may cause double vision. Pituitary tumors or adenomas affecting the optic nerve may lead to loss of field of vision, which means your peripheral vision may be affected. In simple words, if you are staring straight ahead, you will be able to see only what's directly in front of you and not sideways, almost as though you were looking through a tunnel. This is why this type of vision loss is also known as tunnel vision. Sometimes, flickering or twitching eyes may also be a sign of a tumor in the cerebellum. Seeing floating shapes in front of your eyes, seeing everything double, or losing vision on and off may all indicate tumors in different parts of the brain. 5. Clumsiness, loss of balance and coordination. If you are finding it difficult to maintain your balance while walking or having difficulty coordinating your hands and legs, it might be a symptom of brain tumor. This might be caused by a tumor in the cerebellum, the primary motor cortex, or the parietal lobe, all of which are responsible in different ways for the coordination of movements. A brainstem tumor that affects hearing can also contribute to loss of balance. If your clumsiness can be attributed to numbness or weakness in one side of your body, it might be caused by a tumor in the parietal lobe. As the brainstem and the frontal lobe control muscular movements related to swallowing and speaking, respectively, patients also have trouble with these activities if they get tumors in these areas. Loss of balance, lack of coordination in limbs, trouble swallowing, and numbness or weakness in one side of the body can be because of brain tumors. Who gets brain tumors? Most brain tumors develop in people over the age of 50. If you have a family history of brain tumors or your brain has been exposed to radiation, say, during radiotherapy, you might be at higher risk. Treatment options. Do keep in mind that many of the symptoms mentioned here can also be caused by various other conditions and sometimes even due to deficiencies. So, there's no reason to panic. However, it's always a good idea to get a checkup if you have persistent symptoms that could indicate a brain tumor. Your doctor might do a neurological exam and tests like a CAT scan, an MRI, or biopsy. Treatment for brain tumors can include chemotherapy, radiation therapy, surgery, targeted therapy, where substances that target cancer cells and leave normal cells unharmed are used for treatment, or a combination of these. Five main causes of kidney stones. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. Kidney stones have many causes and can affect any part of your urinary tract from your kidneys to your bladder. Often, stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. As kidney stones can be hard to discover from a lack of symptoms, it is important to recognize the cause of kidney stones, so you can minimize and prevent the appearance of kidney stones. If you believe you are at risk for kidney stones, talk to your doctor about being tested. Here are the common causes of kidney stones. 1. Low urine volume. A major risk factor for kidney stones is constant low urine volume. Low urine volume may come from dehydration from hard exercise, working or living in a hot place, or not drinking enough fluids. When urine volume is low, urine is concentrated and dark in color. Concentrated urine means there is less fluid to keep salts dissolved. Increasing fluid intake will dilute the salts in your urine. By doing this, you may reduce your risk of stones forming. Adults who form stones should drink enough fluid to make at least 2.5 liters of urine every day. On average, this will take about 3 liters or 100 ounces of fluid intake per day. While water is likely the best fluid to drink, what matters most is getting enough fluid. 2. Heredity or family history. The chance of having kidney stones is much higher if you have a family history of stones, such as a parent or sibling. And if you've already had one or more kidney stones, you're at increased risk of developing another. Some people are more susceptible to forming kidney stones, and heredity may play a role. The majority of kidney stones are made of calcium, and hypercalciuria, high levels of calcium in the urine, is one risk factor. The predisposition to high levels of calcium in the urine may be passed on from generation to generation. 3. Geographical location. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. There may be a geographic predisposition to forming kidney stones, so where a person lives may make it more likely for them to form kidney stones. There are regional stone belts, with people living in the southern United States having an increased risk of stone formation. The hot climate in this region combined with inadequate fluid intake may cause people to be relatively dehydrated, with their urine becoming more concentrated and allowing chemicals to come in closer contact to form the nodus, or beginning, of a stone. 4. Diet. Diet can also affect the chance of forming a stone. One of the more common causes of calcium kidney stones is high levels of calcium in the urine. A diet high in animal protein, such as beef, fish, chicken and pork, can raise the acid levels in the body and in the urine. High acid levels make it easier for calcium oxalate and uric acid stones to form. The breakdown of meat into uric acid also raises the chance that both calcium and uric acid stones will form. Because oxalate is a component of the most common type of kidney stone, calcium oxalate, eating foods rich in oxalate can raise your risk of forming these stones. 5. Medications. Some medications, and calcium and vitamin C supplements, may increase your risk of forming stones. People taking diuretics, or water pills and those who consume excess calcium-containing antacids can increase the amount of calcium in their urine and potentially increase their risk of forming stones. Taking excess amounts of vitamins A and D are also associated with higher levels of calcium in the urine. Patients with HIV who take the medication indinavir, Crixivan, may form indinavir stones. Other commonly prescribed medications associated with stone formation include phenytoin, dilantin, and antibiotics like ceftriaxone, rocephin, and ciprofloxacin, Cipro. Be sure to tell your healthcare provider all the medications and supplements you take, as these could affect your risk of stone formation. Do not stop taking any of these unless your healthcare provider tells you to do so. 6. Lack of exercise. Although nobody claims that a lack of exercise can directly lead to kidney stones, there does appear to be a clear connection between people with sedentary lifestyles and the incidence of kidney stones. In some cases, people have little choice in the matter. For example, consider the case of one who has to spend an extended period confined to bed due to an accident or illness. However, if it is possible to follow a regular exercise routine, please do so. In addition to avoiding kidney stones, there are many other health benefits.